Hi, yes, it's a pleasure to see you all from different parts of the world joining for yet another lecture under the webinar series organized by the Sri Lanka Veterinary Association, the SLVA. Good afternoon, good morning, and good evening to all of you. Today's lecture is on rabbit management and treatment, conducted by Dr. Ganga Wijesinghe, who has immense experience in working in the zoological gardens. And also, as usual, this webinar goes live in our SLVA YouTube channel, so anyone can join through YouTube also. Before the lecture, I would like to invite Dr. Erandika Gunawardana, President, Sri Lanka Veterinary Association, to address this virtual gathering.
Hi, Chandika. Good afternoon to everybody. Thank you very much, Dr. Chandika. Actually, I'm very happy today that we are conducting another successful webinar of series of webinars that we have conducted by the Sri Lanka Veterinary Association. We had to compel to transfer from this our physical CPD, conducting a series into the virtual platform under this COVID pandemic situation in the country. But we didn't stop working on that. We saw a lot of our stakeholders, our veterinarians and our senior veterinarians, our colleagues and our teachers also have joined to this webinar series to update their knowledge. And in that case, we are quite successful in this webinar series. And what we were trying to actually, rather than inviting foreign expertise in different fields, and we were trying to give opportunity to our local veterinarians because we need expertise on our field, on our different fields from our local vets, and there are improvements actually. So I think we were quite successful in that effort, because we want to make specializations of different fields. We are very happy that vets are coming and becoming specialized in the particular fields, and we can then they can refer more, and then they can share their knowledge to upgrade for the sake of entire veterinarians in the country. So once again, welcoming you all, my teachers and my other colleagues, senior colleagues, and the vets who are joining here with us through the virtual platform from all over the world. And I'm again welcoming you all. I hand over the podium to Dr. Chandika, and I wish Dr. Ganga will do a good job on this rabbit treatments and management care of rabbits, because she's very fond of rabbits, I know. So Ganga, all the best for you then. Okay, Dr. Chandika, go ahead, please. Thank you very much.
Thank you, Dr. Erandika. I would now invite Dr. Sugat Pemachandra, Secretary, Sri Lanka Veterinary Association, to introduce our speaker, Dr. Ganga, to you all.
Thank you very much, Dr. Chandika Wijesinghe. It's a pleasure to introduce our resource person today, Dr. Ganga Wijesinghe. Dr. Chandani Ganga Wijesinghe is currently attached to the Animal Health Division of the Department of Animal Production and Health, where she coordinates the project on mitigation of disease risk to livestock and human through targeted wildlife disease surveillance, and facilitate investigation and research on wildlife diseases that threaten wildlife population, public health, and the economy. She completed her BVSc degree from the University of Peradeniya in 1997 and master degree in wild animal health in 2005 and veterinary epidemiology and public health in 2018 from Royal Veterinary College, London. She joined the government service in 2000 and he worked as a zoo vet for 14 years at the Department of National Zoological Gardens, Sri Lanka. Since 2014, she is working at the Department of Animal Production and Health and has experience in wildlife disease surveillance for more than 6 years. She had undergone training at the zoo, London Zoo, and Westnet Wild Animal Park, UK, Toronto Zoo and Wild Health and Conservation Centre, University of Sydney, Australia, and the Canadian Wildlife Health Cooperative. She had completed her MSc research at Port Clyde Wildlife and Safari Park, UK. Her current interests include development of National Wildlife Health Program in Sri Lanka, broad-scale wildlife disease risk assessment, wildlife forensic and leadership skills in wildlife health. And also she's a well-famous wildlife veterinarian in Sri Lanka as well as in overseas also. On behalf of Sri Lanka Veterinary Association, I would like to invite Dr. Ganga Wijesinghe to conduct the program. Thank you.
Thank you, Dr. Sugat. Before we start the lecture, I'd like to, as usual, remind the structure of this program. As usual, there'll be a 1 to 1.5 hour lecture initially, followed by a Q&A session. And in the Q&A session, we entertain both live questions and also you can text your questions using the chat option of the Zoom platform so that we can incorporate those questions also in between. And also request from the organizers to mute your microphones so that we can have an uninterrupted session. Dr. Ganga, over to you.
Good afternoon, everyone. And thank you, Dr. Sugat, for your kind introduction. And thanks, Dr. Chandika, for moderating this session. So today's topic is management and veterinary care of pet rabbits. And as you all know, rabbits belong to the order Lagomorpha. And there are two families in this order, and rabbits and hares in one family, which is called Leoparidae, and the pikas are Ocotondidae. And all the lagomorphs are herbivores. And I thought of explaining about the wild rabbit behavior and diet. So you can, when you have pet rabbits, if you try to mimic as much, although it's not that easy, but if you try to mimic that facilities in the captivity, you can have them healthy and happy. So rabbits are prey animals and they are crepuscular. That means they are active at dawn and dusk mainly. And during the daytime, they remain underground burrows to avoid predators. And they have very good eyesight. They have big eyes located on either side of the head, which gives them a broad field of vision. And they have large ears, which can be moved independently and which can make up about 20% of rabbits' body surface, and which help them for thermoregulation as well as enable them to hear very well. And they have very good sense of smell because it helps them to alert for the presence of predators. And their hind limbs are very muscular and they can stand up on the hind limbs and scan the area for predators. And they also use those muscular hind limbs to thump on the ground to alert other rabbits for the presence of a predator. So rabbits love company and they like spending time with their humans as well as other rabbits and other animals, because they are social animals in the wild. You know, they live in groups and they are very smart and they are curious, but sometimes they can be aggressive or destructive if the environment or the conditions are not suited for them. So rabbits can be trained using positive rewards and they can be trained to use the litter box. So they are okay with dogs and cats, but they are very sensitive to noise. So loud birds, talkative birds like cockatoos and macaws or constantly barking dogs can really stress them out. So if your clients have rabbits and other pets of different species, you have to advise them to monitor the interactions between these animals. So rabbits can live for about 7 to 10 years, and with the right diet and right management, they can live for even 12 to 14 years. So in the wild, rabbits are social animals, then they live in groups, and so you can house rabbits together. So group housing is successful, but although they are social, they have different complex social structure in the wild. So sometimes mature males can fight and inflict serious injuries on one another. And generally they are considered as timid and non-aggressive, but they will display defensive behavior, which is like thumping hind legs on the cage floor and biting and charging towards the front of the cage when open. So if a rabbit displays this kind of behavior, that means they are not secure and they are not very happy with the conditions you are giving. So rabbits are very athletic also. They have long, powerful hind limbs that they can even achieve a speed up to about 50 miles per hour for short bursts. In the wild, when they are chased by predators, they can run fast and they can make irregular movements to help confuse the predator and outmaneuver them by this quick burst of movement. So rabbits' behavior mainly via scent. That main mode of communication is via scent. So they deposit feces, they squirt urine, and they chin mark to communicate with other rabbits. And they also display different body postures and vocalizations to communicate, but their vocalizations are very quiet because they are prey species, so they try to avoid detection by predators. So this poster, which is made by RSPCA, shows different body postures of rabbits. When the rabbits are relaxed and when their ears are up and when they jump around, you can see that they are very happy and they are not nervous. But worried rabbits, you can see they crouch and they keep the ears apart, and then ears may be lying along the body, and when they try to hide if they don't feel safe and secure. So when they are angry and when they are unhappy, they will try to run away from you. They will try to sit. Most of the time, they try to stand and scan the area when they don't feel secure. And they will thump their hind limbs on the floor of the cage, or they try to snarl, like they display their teeth and try defensive behavior. So from the body postures also, you can get an idea whether your rabbit is happy or whether he's worried or whether he's angry. So biology of behavior of pet rabbits are very similar to wild rabbits. So they need they have a lot of complex needs, and they need like secure, comfortable environment. So traditionally, rabbits were thought as good pets for children, but this is not the case because rabbits are prey species. They are very susceptible to stress, and they get easily stressed out, and which can lead to so many other problems. So rabbit is not a good pet for very young children. So especially when the children try to hold rabbits when they want to move away, which will cause a lot of stress and pain to the rabbit. So the rabbits are very active. So when you provide the environment, they have enough space to run, jump, hop, dig, and they should be able to stand up fully on the back legs. And when they lie down, there should be enough space for them to stretch out fully. And they need regular and frequent opportunities to exercise every day to stay fit and healthy, and an appropriate place to defecate and urinate, because most of the time rabbits select one place to do their defecation and urination. And rabbits are very inquisitive animals. So they may try to easily injure themselves, because if they let loose, if the rabbits are not caged all the time, and they shouldn't be caged all the time, they should be let loose to move around in the house. So, but make sure that environment is safe for them, because they try to nibble things. They might chew on an electric wire or something which can electrocute them. So you have to rabbit-proof the house if the rabbits are let loose in the house. And the other thing is rabbits must be able to hide from things that scare them. So they need to feel safe all the time, and it's better to provide them with safe hiding places as well as platforms where they can climb and look around the area. So housing, if the rabbit is housed more like in a cage most of the time, it should be as large as possible, and at least the length should be. You can just measure the length by make sure that the length should be at least 5 times the length of the rabbit when he's fully stretched out. So there'll be enough space for the rabbit to run around and hop, and sufficient not only the horizontal space, vertical space is also important. So the rabbit can stand up on the hind legs without bumping the head on the cage. And cages with solid floors are the best, because wire floors can cause foot and leg injuries, because most of the time people think it's easy to clean when the rabbit urinate and defecate. If you have a wire floor, the feces will fall through the wire mesh, but it is not good for their feet. So cages with wire sides are highly recommended in order to provide adequate ventilation. And they need to have at least one hiding place or a tunnel so that they can hide when they want. And bedding material is also important for them to keep them warm and comfortable. But when you use bedding material, make sure that you don't use clay or cat litter, which can clump, because rabbits like to eat things. So they might you have to provide bedding material which is safe even if they ingest it. So these are some few designs of rabbit houses. So you can see the sides are made of wire mesh, and there's bedding on the floor, and the platforms for the rabbits to climb up, and hiding places. There are different types of hiding places so the rabbit can choose the place. And here also you can see a lot of hiding places, and the floor is grass, so rabbit can even eat it, and it's much more natural, but sometimes it's a bit difficult to clean. Here also another idea for a rabbit house. There are ramps so rabbit can climb and go into the hiding place. So enrichment is very important because rabbits are playful, intelligent animals. If they don't have enough variety and daily enrichment, they can become easily bored and they can become very destructive. So rabbits love toys, which provides them with mental stimulation as well as exercise. So as I told you earlier, they are mainly active during dawn and dusk. So you can provide playtime during that period, and but always advise the client to supervise the rabbit during playtime, because then you know if something like if some injury or somehow if rabbit try to eat something, you can prevent it. And by enrichment, you need to stimulate their normal behavior, natural behavior. So these are some of the enrichment ideas: cardboard boxes filled with hay, and food hanging with clothes pegs, so the rabbit can stand or stretch the neck and eat it, and hiding places, logs with holes, and then different hiding places made of natural things, and play toys made of natural things, which is these things, even if rabbits eat it and chew on it, will not harm the rabbit. And these are hay bundles and straw bundles and pine cones, so rabbit can munch on it and they can play with it. And when sometimes because when you advise the clients that rabbits are social animals, then they are happy, and when they are with other animals, they might want to introduce new rabbits to their pet. So, but although they're social, they are territorial by nature. So it is important to consider rabbits' personality when planning introduction of new rabbits. Sometimes it if the rabbit is dominant, the pet rabbit is dominant, sometimes it's going to be very difficult to introduce another rabbit to the pet rabbit. because it can, while trying to do something beneficial, you might actually harm the rabbit. So male-female pairs tend to bond easier than male-male pairs, but make sure that both rabbits are, like females are spayed and males are neutered. So it will prevent unwanted pregnancies, but it will also reduce aggressive behavior and territorial behaviors. So once a potential match is chosen, when you first introduce them, don't go and introduce them straight away. Keep them apart via crate or something, so they can interact with each other via smell and visually. They can have visual contact, and they can communicate each other by calls. But then monitor the behavior. Ask the client to monitor the behavior. If the both rabbits are relaxed and if they lie next to each other on either side of the barrier, and they are grooming and they look okay, you can go and try to introduce them. It's better to introduce them in a natural territory rather than putting the new rabbit into the old rabbit enclosure to avoid any territorial behaviors. So the other thing is you have to remember to advise the client to quarantine new rabbits, because the new rabbits can, as soon as they are purchased, most probably from pet shops, you might have to deworm them and do health checkups before introducing your rabbit to the new rabbit. So the signs of the bonding process is going well include sniffing and snuggling and ignoring each other and pretending to have no interest of each other, because if they're stressed out, if they're worried, they will be vigilant of each other's behavior. So the other thing is, if you notice that one rabbit is trying to mount the other one, and if the other one try to run away, that means dominant rabbit and a submissive rabbit. So it can, with time, it can work out, but at the beginning, you need to monitor them really well, because otherwise one rabbit will, submissive one will get bullied by the dominant one. So rabbits feeding is the most, we can say the most important thing when you rear rabbits, because most of the rabbit issues related directly or indirectly to their diet most of the time. So rabbits, as you all know, they have an unusual digestive system. Food pass through their gut, and they produce special droppings called secretrophs. And then rabbits eat that soft feces and allowing food to be digested. And they are hind gut fermenters, so they are very sensitive to dietary changes. And they also have very continuously growing teeth. It says that incisors grow at a rate of 1 millimeter per week. So, and in the wild, rabbits spend about 70% of their time above ground feeding. So this continuous feeding of wild grasses, which are very aggressive, can wear off the rabbit's continuously growing teeth. So in captivity also, you have to provide a diet with very high fiber for the rabbit, for the proper functioning of the GIT, plus which helps them to wear this fast growing teeth. So grass and hay should be offered to them ad libitum. So the main, about 75% of their diet should be grass and hay. So you can also give high quality, high fiber pellet food, but in small quantities, because rabbits have rabbits are prone to obesity. So in the pet shops, most of the pet shops in Sri Lanka, when they sell rabbits, they sell pellet food also, but that are not made for rabbits. Most of the time, those are broiler feed. So you should advise our clients not to feed rabbits with broiler feed, because definitely the rabbit will be obese if they continue to feed them with high energy, highly digestible broiler feed. So fresh green leafy vegetables can also be included in the rabbit's diet. But when you introduce any new thing, you have to introduce it gradually, small quantities at the beginning, and then you can increase it if it doesn't cause any problem. And the other thing is you need to advise the client not to introduce too many things at one time, because if something happens, then you don't know what had caused the problem. So introduction of one new thing at a time is the best way to avoid unnecessary digestive problems. And fresh fruits and root vegetables can also be given as treats, but not as a diet. If the rabbit is obese, advise them not to give treats at all. So, but the problem is people think rabbits' main diet is carrots because of the cartoons and paintings of rabbits with carrots. People think that is their main diet, but carrots shouldn't be given as a diet. It should only be given as treats. So rabbits, like any other animal, rabbit require fresh water at all times. Make sure the waters are clean properly, because it can get contaminated with feces. And when you offer food and water, avoid plastic dishes, because as I told you earlier, they love to munch on things, so they can munch on plastic and can inject plastic pieces. And when you give fresh vegetables and fruits and root vegetables, make sure that those are washed thoroughly, because rabbits are very sensitive to chemicals. So if there are any chemicals sprayed onto those fruits or vegetables, it can harm the rabbit. So this is, I have included this for you to get an idea about the amounts you need to include in their diet. So as you can see, the most part of the diet should be hay and grass, and you can include some leafy green vegetables, and then small high fiber, high quality pellets and treats, very small amount, about 2% of the diet, and you can give once or twice a week, but not, you shouldn't encourage clients to give treats if the rabbit is obese, because they have very sweet tooth and they like to eat sweet things. So once rabbits started eating sweet things, it's really difficult to get them eating grass and hay, which is not that palatable. So when you handle rabbits, you have to do it very gently. When you approach a rabbit, it's better to approach from a side, because they have in both sides, they have very good vision, so they know you're coming towards them. It's not unexpected. So, and you can stroke the rabbit gently and put your hand underneath the tummy and gently lift the rabbit, but have the weight on its bottom. You have to support the back of the rabbit, and then you can settle the rabbit across the body. But if you point the rabbit's head towards up towards your shoulder, he might try to climb up. So best thing is to settle the rabbit across your body and hold it securely. If the rabbit struggles or kicks out, it may damage the spine, and so you have to hold the rabbit securely and confidently, so the animal doesn't sense your nervousness and take advantage of it. And the other thing is, when you are holding the rabbit, it might try to reverse. So always better to put a hand on back of the rabbit, so he can't reverse back. So if the rabbit is very nervous of being held and struggles a lot, you should never force the rabbit. But best thing is to wrap it with a blanket or a towel, so the rabbit will feel more secure, and you will also it will also protect you from getting scratched badly, because rabbits have very powerful hind limbs and they can scratch you really badly. And when you are going to release the rabbit, you have to make sure that you kneel down and let the rabbit go, because if the rabbit senses that you are going to release him, he can jump from whatever the height, so which can cause injuries. So we try to kneel down on the floor and then gently let the rabbit jump off your hands. So these are some of the pictures. You can see how to handle rabbits. So most of the clients, even especially children, think the rabbits have to be caught from their ears. You should advise them never to do it, because it's very painful. Ears are very sensitive. So you can scruff a rabbit, but always try to support them from the back legs, bottom part need to be supported. And then when this is another way of handling them. If you try, like if you cover the eyes with your elbow, most of the rabbits will much more secure. So when the rabbits are transported, make sure that they are comfortable and safe all the time, and putting similar smelling items, familiar smelling items in the carrier will make the rabbit feel much more at ease. So you can put their toys or the blankets or something in the carrier when you transport rabbits. And the rabbits who live together can be transported in the same carrier. So if there are, especially if they are coming to the clinic, then you can take them out, and then different smells can get into the rabbit. So after you go home and try to introduce, the other rabbit might not recognize that. Might have difficulty in recognize the different smells. So if they are transported in the same cage and ensure same scents are transferred to all rabbits, it would avoid problems associated with reintroduction. And grooming is also very important. Rabbits are naturally fastidious groomers, so they need rarely, if ever, need to be bathed, but you can bathe them if you want. But if you are bathing, make sure that you are using lukewarm water, and then dry them immediately using a hair dryer, because rabbits are prone to hypothermia because of the large body surface compared to their body size. And brushing rabbits is very important, because especially during shedding season, to prevent them ingesting too much hair while trying to groom them. Otherwise, this ingestion of large amount of hair can lead to trichovesuas and GIT obstructions. And rabbits also need to have their nails trimmed, because especially in rabbits, if they don't get enough exercise, and the rabbits in small apartments need to be, their nails need to be trimmed regularly. And if you don't groom them daily, sometimes the hair can get matted, and you might have to clip the hair, and otherwise it can lead to skin issues. So breeding, most of the time, it's not like most of the clients don't want to breed rabbits. They just want to have 1 or 2 rabbits. But if I have included this for you to get some idea about the breeding. So normally, especially if the clients want advice, how not to breed them, then you can advise them on this. The rabbits generally come into puberty when they're about 5 to 7 months old, but smaller breeds can come to puberty earlier, and large breeds like Flemish giant rabbits reach the sexual maturity much later than that. And breeding life of a female will last for about 3 to 4 years, but sometimes the females can be reproductively active for about 5 to 6 years. And pregnancy can be confirmed at about early as 14 days of gestation by palpation. If you take radiographs, you can diagnose the pregnancy earlier than that. Normally, gestation period is about 1 month. And during the latter part of the gestation, you can see the females try to pull hair, and you can see the nest building behavior. So if during the latter part of the gestation, you have to provide them with nest box and nesting material like soft bedding, like shredded paper or straw. And then the female will line the nest box with the fur before the parturition normally. And when you place a nest box, make sure that it's not placed in the area where the rabbit had selected as for urination and defecation. So parturition occurs during early mornings normally, and it takes about half an hour to 1 hour. And both anterior and breech presentations are normally in rabbits. So average litter size is 7 to 9, but it can vary depending on the breed. And after young are cleaned by the female, female consumes the placenta. And lactation, the females have about 4 to 5 pairs of nipples. And you can see the mammary development at the last week of pregnancy. And normally those nurse the young ones once a day for several minutes, usually early in the morning or in the evening. And small bunnies will start consuming food, solid food, when they're about 3 weeks of age, and weaning occurs at about 5 to 8 weeks of age. So cannibalism, sometimes you notice cannibalism in rabbits due to this happens mainly when they are under stress or when they are nervous, or if first time mothers can also kill they don't know how to look after the baby, so the young ones can die. This cannibalism of dead young occurs as a natural nest cleaning instinct. So if young rabbits die of some reason, the female will eat them. So, but then if this happens, you have to rectify any environmental or any issues. You have to find out the cause of it and then correct it. But even after all the correct management and proper environment provision, still if the female kills the litters in 2 in a row, you have to remove the female from the breeding or get the female spayed. So when you consider the health management, the rabbits need regular treatment for GIT parasites. You can use pyrantel palmoate, mebendazole, albendazole, or fenbendazole. Make sure the rabbits are weighed and the dose is adjusted properly. And annual routine health check is important. So advise your client to bring the rabbit for annual health checkups, where you can check the body weight, you can examine the teeth, you can examine the eyes and ears and the coat, and correct any issue before it progresses into a disease or a difficult clinical condition. And in Sri Lanka, you need to vaccinate them with anti-rabies vaccine. In some other countries where myxomatosis and rabbit hemorrhagic disease present, the rabbits need to be vaccinated against those diseases. And the client should be advised to check rabbits for any illnesses or injuries every day. And body weight, teeth, especially the incisors and nails, should be checked at least once a week by the clients. Tell them to check the teeth especially, because there could be a lot of teeth problems which go unnoticed. And then you need to, if they are not planning to breed the rabbits, females need to get spayed and the males need to be neutered. And regular grooming is also very important. Rabbits, most of the rabbits, pet rabbits we have encountered, we have seen, the main issue we see is the teeth issues. So rabbits have incisors, premolars and molars. They have about 26 or 28 teeth. So in the front incisors have tiny, like behind the front incisor, upper incisors, there are peg teeth, which are also incisors. So all these incisors can help them for the rabbit to bite and shear food. So as I told you earlier, the rabbit teeth continuously grow throughout the life. And unless there is normal occlusion and use are sufficient to wear teeth to normal length, there will be overgrowth of teeth. So rabbits normally masticate food with chewing motions that facilitates grinding of food by movements of premolars and molars from side to side and front to back. And the dental issue, when you consider the dental issues, there are different reasons for it. Some are hereditary. The hereditary mandibular prognosticism, if it occurs, you can easily identify it by lower incisors. Normally in rabbit, normal positioning of teeth is like this. Upper incisors are just anterior to the lower incisors. So in this case, you can see lower incisors growing anterior to the upper incisors. And then upper incisors grow because there is no occlusion, proper occlusion. The upper incisors can grow into the mouth and damage the hard palate, cheek, and tongue, causing secondary bacterial infections, abscesses, etc. These animals with this hereditary condition shouldn't be bred. But the main problem we see is diet lacking enough roughage or fiber to promote normal tooth wear. That is the most common condition you encounter. And traumatic injuries also can lead to this because young rabbits can damage their incisor teeth by pulling on cage wire. So once the teeth are damaged, sometimes it starts going on in different directions, and there won't be any proper occlusion, which causes overgrowth of teeth. And these rabbits, as I told you earlier, they are prey species. So in the wild, they try to hide pain and discomfort because otherwise they will be a target for a predator. So it's same behavior you see in the captive rabbits. So at the beginning, you might not notice any change. They try to pretend that they are eating and they move around slowly. Unless you closely monitor them, these signs will go, subtle signs will go unnoticed. So first thing you might notice is reduced appetite, which will progress into anorexia if not treated, and weight loss. That's why the weekly weight monitoring is important. And coat can be dirty looking because with the overgrown teeth and when there's pain, it's difficult to groom and it's painful. So sometimes you can see pawing at the mouth, and excessive salivation can be seen. Tearing, teeth grinding is a common sign because sometimes when the rabbit comes to you with the signs of teeth grinding, like clients say the rabbit is not eating much, and they can hear the teeth grinding. And sometimes you can see facial swellings if there are abscesses, and runny nose, and they are less active due to pain, and long, of course, the long, if you can see the deformed and long teeth, you can easily diagnose this condition. And overgrown, when the teeth are not, there's no proper occlusion, teeth can grow into points or sharp spikes, and it can badly cut the cheek, tongue, and cause secondary bacterial infections. And even overgrown lower molar can make a breach over and entrap the tongue. So when this is very painful condition because sometimes when the molars and premolars are overgrown, it can cause impaction of teeth, like in wisdom teeth impaction in humans, which can cause a lot of pain, and rabbits are very sensitive to pain. And if you notice a rabbit with overgrown incisors, you have to always check the molars and premolars, because the main cause could be overgrown molars or premolars, because when the molars and premolars are overgrown, the rabbit can't close the mouth properly. So there is no occlusion, proper occlusion of incisor teeth, which causes incisors to overgrow. So you might only see the overgrown incisors, but make sure that you check the molars and premolars as well. So teeth trimming is the treatment for this. So this is the way that rabbits front teeth should look like. And but before you trim the teeth, as I told you, do a proper clinical examination and then decide on treatment. So dental burrs can be used to file down incisors and molars. You have to do it generally under general anesthesia. So care should be taken to avoid exposing palate cavity by excessive trimming. And treating poorly aligned molar teeth can be challenging because rabbit teeth is mouth is small and it's very narrow. So operating to grind the molars can be challenging and takes time. And annual veterinary checkups are crucial for all rabbits to identify any teeth issues and prevent them, you can identify them early before progressing into a complicated situation. So these are the equipments that you need. When you have proper equipments, it's easy, comparatively easy to do the trimming. So cheek dilators and retractors. And then when you use those instruments, you can open the mouth fully when under general anesthesia. So these circular burrs are good to trim the front incisors, and it's better to use a guard to avoid damaging cheek and the lips. And straight burrs can be used to grind sharp spikes of molars and premolars. So here you can see the sharp spikes first, buccals first and inguinals first. When the molars and premolars grow into these sharp into the spurs, it can badly damage the tongue and the cheek, cause pain and appetite reduction in rabbits. And this you can for general anesthesia you can use a mask, but if the procedure takes long time, you can use this gel alternative for endotracheal tube, because anyone who had tried to intubate a rabbit know how difficult it is. So these gel tubes are much easy. They can nicely seal the rabbit's trachea, and you don't need much specialization or experience in fixing, like putting these tubes in. So you have to achieve this state after trimming. So as I told you, the circular burrs can be used to trim the front teeth, but use a guard, so it will be much safer. So if a rabbit comes to the clinic regularly for teeth trimming, sometimes they need to come back every 2 weeks, sometimes every month for teeth trimming. So you need, sometimes you have to go for tooth extraction. So it depends on like time. The procedure can be complicated depending on the number of teeth affected, and so when you do a proper oral examination, and it's better to take radiographs also before deciding on what are the teeth to be extracted. So you need you need special equipments, like you need specialized rabbit incisor luxators or similar curved instrument to remove incisors, because they are curved, and you have to use the fine tip dental elevator to remove the free the tooth to be extracted. So if infected, the socket after removing the teeth, you have to lavage the area and then filled with an antibiotic gel like metronidazole, or in some countries they have antibiotic impregnated beads you can put into those sockets after tooth extraction. So after the tooth filing or extraction, it is very important to get the rabbit eating immediately. So the other thing I forgot to mention is, before anesthesia, you shouldn't starve rabbits, because rabbits can't be starved. Like starvation can cause so many other problems in rabbits. So don't advise your clients to starve the rabbits when they come for any anesthetic procedure. So soon after recovery also, they should be encouraged to eat immediately. So if you're keeping the rabbit if you're keeping the rabbit at the clinic, soon after recovery, you have to provide the rabbit with food. So if they're not eating, most of the time it's very rewarding to see the rabbit starts eating immediately after you correct the dental issue. But if there are like infections, if there is severe pain, rabbit might not eat immediately. But then you should start syringe feeding the rabbits, and you have to advise the client on syringe feeding if the rabbit doesn't start eating immediately. And pain management and systemic antibiotics must be necessary, especially if there are the injuries to the tongue or cheek due to sharp spikes of teeth, overgrown teeth. So tooth root abscesses can be seen in rabbits when the dental issues are not diagnosed at early stage. So, but this is very painful condition and very difficult to be treated. Sometimes even with long-term systemic antibiotics and pain management, this will never get fully resolved. Sometimes we have to treat throughout the rabbit's life for this condition. So if you diagnose tooth root abscesses, best thing is to do a culture and ABST and get a proper antibiotic rather than just giving haphazard treatments. So I have put some medications that can be used for anesthesia in rabbits. So pre-medication, you can use azithromycin, diazepam, midazolam, and anesthetics can, like injectable anesthetics or gaseous anesthetics, can be used in rabbits in combination or as a single agent. So ketamine, azithromycin, ketamine, xylazine, ketamine, midazolam, ketamine, diazepam, and you can use propofol or isoflurane can be used. And my personal, I like to use midazolam or diazepam pre-medication with isoflurane, which is less risky and much safer. And especially when you don't have reversal agents for xylazine. So as analgesics, you can use ketoprofen, carprofen, meloxicam, and flunixin. And atropine can be used to prevent bradycardia and excessive secretions during anesthesia. Rabbits have serum atropinase enzyme, so you might have to give high dose of atropines in some rabbits to get the desired effect. So anesthetic monitoring is also very important while during the anesthesia. You have to monitor the rectal temperature because rabbits are prone to hypothermia, and monitor their heart rate and respiratory pattern and the rate. And the best thing is to put the rabbit on a heat pad so you are sure that you can maintain the body temperature while anesthesia, especially if we are doing a procedure that takes a long time. And you can even infuse warm intravenous, subcutaneous, or intraperitoneal fluids. Especially if you are using injectable anesthesia, this will reduce the recovery time. And if the procedure takes long time, it's good idea to give warm IV fluids. And careful monitoring and minimal anesthetic time are important for successful rabbit anesthesia. So then we'll move on to some other clinical conditions we encounter in rabbits. Skin disorders are very common in rabbits, which can be due to mites. Infectious diseases like infectious diseases could be due to bacteria, due to fungi and viruses. And there could be skin problems due to behavioral issues, and trauma and neoplastic diseases are some other causes for skin disorders. So I'm going to only talk about common conditions. So ear mites, you very commonly see in rabbits. This Soroptis mite is a non-burrowing mite, and you can see this type of lesions in the ear, and very crusty accumulates, and it's very pruritic lesion, and you can see rabbit scratching, and by scratching they can damage the ear further, and this you can see head shaking and even self-mutilation. And the fur mites, Chilotella, different species of Chilotella can cause this problem. You can know the site mainly is over the scapula. You can see hair loss, and the skin may be white or gray. And this condition is not pruritic. So this is also a non-burrowing mite. So you can, when these flakes will have mites if you examine them. But this is considered as zoonotic. So because it can, this chilotella mites can cause transient dermatitis in humans. And mange mites are also common in rabbits, like in dogs and cats, Sarcoptes caviar. So this can cause intense pruritus, and this is a burrowing mite. You can lesions are common on the head, and it can spread fast into other part of the body if not treated. This might also cause a self-limiting dermatitis in humans. So it is also zoonotic. So diagnosis for these mite diseases, some mites are like especially Seroptis mites are large enough to be seen with the naked eye or with an otoscope. And so these non-burrowing mites like Chiletiella and Seroptis, you can mount the scabs on a slide with KOH and then examine under a microscope. But for Sarcoptes mites, because it's a burrowing mite, you need to get a skin scraping to diagnose the infection. So treatment is ivermectin. The dose rate is 200 to 400 micrograms per kg slump cut. So for scabies, you can use lower doses. Chiletiella and Seroptis, you have to go for 400 micrograms. And the main advice you need to give to the client is that they need to bring the animal again after 10 to 14 days. Because even with one injection of ivermectin, the lesions might disappear, but the mites mites can be still found on the body. If you don't repeat the treatment, the condition can recur. And control, depending on treating all the rabbits in the group. And then heat and desiccation will kill the parasite. So boiling the towers and the toys and the rabbits items in the rabbit's environment, and clean the cage with hot water, and then drying it quickly will kill the parasites in the environment. This is very important in the case of Chiletiella and Seroptis mites, because those skin flakes and the ear crusts which fall onto the environment and the rabbit's cage rabbit mites can contaminate the environment, and the condition can recur if you don't treat the environment. So fungal diseases are also common in rabbits, mainly trichophyton and microspora. And this is mainly due to poor husbandry practices, poor nutrition, and the stress, overcrowding, and excessive heat or humidity, or the immunosuppression during pregnancy. So this is Dermatophyte Phytosis is also a zoonotic disease. So you need to advise the client how to handle rabbits with this condition, with the minimal exposure to the pathogen. And normally you see alopecia, and sometimes like dandruff, like skin flakes on the head and face, and sometimes on the feet. And the lesions are often erythematous. You can see the typical circular lesions of ringworm, and raised rim around the lesion that acute inflammation and broken hairs can be seen. Sometimes you can see focal abscesses on hair follicles or the perimeter of the lesion due to secondary bacterial infections. And this disease is transmitted from one rabbit to another rabbit through direct contact or via the contaminated environment. And fomites can be a source of infection, especially if the brushes and the towels and toys are not cleaned and disinfected properly. So diagnosis is skin scraping on a slide with 10% KOH. And you can even use fungal culture, and sometimes skin biopsy is necessary for the diagnosis. Treatment, you can clip the hair around the lesion, and then if the condition is worse, like you can use glyspulvin is the best treatment. You can use 25 to 50 milligram, and you need to continue this treatment for 2 weeks after the disappearance of clinical signs, but get the rabbit regularly to the clinic and examine, do a proper clinical examination and see whether the drug is not causing any problems to the rabbit. And the other thing is, it is very good to keep photographic records. So sometimes you might not remember how it looked like 1 week or 2 weeks ago. So, but if you have photographs, tell the client to take photographs every week, like once a week, so we can compare the condition of the skin. So topical and system, you can also use clotrimazole, aniconazole cream or aniconazole spray as a topical treatment, and itraconazole also can be used as a systemic treatment for dermatophyte phytosis. So these rabbits who have this problem need to be isolated from other rabbits, because otherwise they can transmit the disease to others. And cleaning the environment using like vacuum cleaning and boiling the towels and bleach water is important to minimize the reinfection. So another skin issue is ulcerative dermatitis, which is often referred to as sore-hocks. And the plantar surface of the metatarsal is the region which gets mainly affected. Sometimes metacarpal surface of the metacarpal regions also get affected. And this mainly happens because of the wire flow housing. Because as I told you earlier, they will stomp their hind legs on the ground when they get excited or nervous. So it can damage the plantar skin of the legs. And some breeds have thin fur on the plantar surface, which are more prone to this condition. And poor sanitation, like soggy bedding material, can worsen the condition. And heavy rabbit breeds and obese rabbits are more commonly affected because of the body weight. So treatment involves like you have to rectify any issues, like if the rabbits are kept on wire meshes, you need to advise client to put the rabbits into a flow with solid flow. And if the rabbits are obese, you need to advise the clients how to reduce the body weight of the rabbit, and to improve the, like give more time for the rabbit to exercise. And as a wound treatment, you can clip the hair, but when you clip hair, make sure that it's not clipped too short, because otherwise you have to, there have to be enough hair to protect the foot. Otherwise, that part will also get injured. And your wound can be washed with normal saline and use normal wound treatments can be done. And you can use salicylic acid, mupirocin, or neomycin topical cream for the wounded area. And but if this condition, if you don't diagnose the condition early, that this can get the condition can develop into abscesses. So the rabbit might need pain management and antibiotics, systemic antibiotics. So anyway, pain management is important, because due to the pain, rabbit might not move around. So you need to get the rabbit move around to exercise, as well as to improve the blood supply. So pain management is very important. And you can advise the clients to softly massage the limbs to improve the blood circulation and improve healing. And bandaging the feet may be helpful, but advise the client to remove the bandage if it gets wet or contaminated. Sometimes this is difficult to, condition is difficult to treat. So make sure that husband conditions are properly maintained. And in some breeds, especially the rabbits with breeds with less fur on the foot, this condition can recur. So these are some pictures of the condition and how you can bandage the leg. But when you use weight trap, tell the client to watch for any edema on the posterior part, like distal part of the limb, because if the weight trap is too tight, the clients will notice it. To avoid that, you can bandage with the thick gauze pad, and then tell the clients to remove it if there's any swelling, or if the bandage gets dirty, tell them to replace the bandage. So moist dermatitis is another common skin condition. Female rabbits have a thick, heavy skin fold on the ventral aspect of the neck. And when they drink, it can become wet and soggy, leading to inflammation. So dental malocclusion, I told you that there'll be excessive salivation. So if there's dental malocclusion, this condition can get worse. So with this continuous wetness on the skin folds, the hair you can see hair loss, and it can get secondary bacterial infections, or it can get maggot infestations. So automatic watering systems are the best, but even if you are giving providing the rabbit open water containers, make sure that the openings are small so the rabbit won't the skin won't get wet while drinking. Or you can keep the waters elevated so the rabbit has raised the head and drink, and it will prevent this wetness of the develop. So if this happens, the treatment is normal, like wound treatments, clip the hair and keep the hair, skin dry. You can dust some antiseptic dusting powder. In severe cases, if there are secondary bacterial infections, you can start parenteral antibiotics and analgesics. So gastrointestinal stasis, it is a life-threatening condition in rabbits. This is also commonly encountered in pet rabbits due to rabbits who are having who are getting poor diet, low fiber diet, and which causes severe stress and pain to the rabbit. And early stages, it can go unnoticed by the client. So the rabbit will gradually stop eating. And most of the time, rabbits are presented to clinics in advanced state of stasis with dehydration, pain, and when the rabbits go, rabbits are anorectic for a long time, it can lead to hepatic lipitosis in rabbits. So the other thing is when they have reduced the food intake for some reason, the water intake also reduces. So the normal gastric contents, which are like slurry-like consistency, can become pasty. To aggravate the condition, as I told you earlier, they like to groom themselves. So they normally swallow hair. But when the gastric contents are slurry-like, the hair will pass through the GI tract without any issue. But when they are dehydrated, when the gastric contents are pasty, this excessive hair can get matted and can cause trichobizoas, which can lead to gastric GIT obstructions. So this in this gastric stasis, due to some either low fiber diet or pain or stress or due to some issue if rabies, and the other thing is this condition can cause due to long-term antibiotic therapy sometimes. So you have to monitor these rabbits who are on long-term antibiotics can be monitored carefully to prevent this condition or to diagnose it at early stage. So in this condition, the stomach and the intestines, you can see gas accumulation, and the rabbit is under severe pain, and the GI motility is reduced, and normal microflora in the cecum, which helps digestion, changes, causing electrolyte imbalance and systemic ketoacidosis and hepatic lipidosis. And in this if progress, this can lead to gastric ulceration and gastric rupture. Like as I told you earlier, the first signs you would see is low appetite, and then animal become lethargic, and there are signs of pain. The animal will stay in one place without moving about, and then the fecal pellets, you can easily notice that they are very small, much smaller than the normal size, and they are normally encased, they are very dry and encased in clear or yellowish mucus. So you have to advise your clients to look for these signs so you can identify this condition early stage before it progresses into a life-threatening situation. So, and the other thing is excessive gas production. So if you auscultate a rabbit with gastric stasis, sometimes you can't hear anything because normally you can hear gastric noises when you auscultate rabbit, a normal rabbit. So sometimes it's very you can't hear anything, or sometimes you can hear like violent gurgles, like gas moving in the intestines. So, and when you palpate the abdomen, you can see the rabbits are tense due to pain. So the goal of treatment is you need to restore appetite as soon as possible, and you need to correct electrolyte imbalance and dehydration, stimulate gastric emptying, promote normal gastrointestinal motility, and you have to soften and lubricate impacted food and hair if it is there, and restore GI microorganism balance. And if there's any obstruction due to a trichobezoa, you need to remove it. So in most cases, you can manage this by aggressive fluid management. Like you have to give about almost double the maintenance fluid dose, like about 10 ml per kg per hour IV. And pain medication is very important because rabbits are very sensitive to pain. And then with aggressive fluid management and pain management, normally they will gradually recover. And then you need to make sure that there is no obstruction. And then you can try, like rabbits, if they don't start feeding immediately, you can slowly feed them, but not don't overfeed them, because if there is if the contents are pasty and it's full of material, you need to rehydrate them, and then gradually wait till the normal gastric motility restored before feeding. But make sure that food is available at all times, like hay and grass. But if the rabbit is not eating at all, you can try giving palatable fiber, like leafy vegetables, for them to stimulate eating. And oral administration of 5 to 10 ml of fresh pineapple juice daily for 5 days has been reported as a treatment. It will help to relieve gas, as well as it will digest the matrix of trichobezoas if it is present. Normally, once they are relieved of pain and rehydrated, they will start eating on their own. So if the rabbit is not eating, rehydration. Can you hear me?
Yes,
Ken, now
Dr.
you are
Ganga.
mute
Yeah.
a bit.
Okay, I got a message saying I'm muted. That's okay.
Yeah, that's okay now.
Right. So syringe feeding should be started, and once GI obstruction has been excluded, you can give metoclopramide to improve the motility. Dose rate is 0.5 milligram per kg. You can give it subcut or per hours, 3 to 4 times daily. And but don't start with metoclopramide. First, you need to do pain management and hydration. So re-establishment of GI microflora can be assisted by probiotic treatment. And the easiest way is to provide cicatrophs from healthy rabbits. Then this normal microflora can be established in this sick rabbit. The main, more than the treatment, the best way to is the prevention of this condition by advising the clients to provide high fiber diet, avoid stress, and to avoid obesity, and to provide environmental enrichment, and grooming and remove loose hair daily. So it will not cause GI stasis, because sometimes by the time the rabbits come into the clinic, they are in so advanced state of this condition, and treatment might not work well. So The next sign of this condition you find in pet rabbit is traumatic vertebral fracture. This happens if the rabbit struggles a lot while during restraint. This lead to vertebral fractures, especially in seventh lumbar vertebra, or its caudal arterial processes are considered to be the frequent site of fracture. The fracture occurs commonly than dislocation. So clinical signs you would first notice is paralysis, urine or fecal incontinence, or perineal staining. And diagnosis is made based on clinical signs and a history of recent struggling or restraint or any other trauma, like sometimes they come with a history that the animal had been caught in something. You can diagnose it by palpation, but radiographs are necessary to confirm the condition. And if the condition is severe, sometimes you might have to take the decision to euthanize the animal. But the cases with moderate subluxation or spinal edema, it will resolve with time with proper treatment. But supportive care is very important, like expression of urinary bladder or prevention of pressure wounds during the time the rabbit is treated for the condition. So, supportive treatment includes anti-inflammatory medications to reduce the swelling, and sometimes methylpenicillin it might be helpful. So, but you need to hospitalize the rabbit during this period because you need to provide IV fluid, nutritional support, and cage rest. And with proper management and nursing care, sometimes the cases that appear hopeless may improve with time, and they'll be able to move on and walk and hop if the condition is not that bad, and the nursing care and management are good. So you need to give time for the rabbit to recover, but make sure the rabbits, it's best if you can hospitalize and treat the fellow rather than sending home. So another common condition in rabbits is eye disorders. Corneal ulcers are common in rabbits. I told you they have big eyes. So the cornea is much larger than most of other domestic pets. And they don't blink frequently as other species, so which leaves cornea less moist. So these are predisposing them for corneal ulcers. So trauma is the main cause. Most of the time, the grass or straw can damage the cornea, or the fighting between rabbits also can lead to damages. So cornea should be protected. The other thing is when rabbit is anesthetized for a reason. So make sure that the cornea is lubricated with artificial tear or some eye drop to prevent it damage and get it dry during anesthetic procedure. So superficial ulcers can be treated with broad spectrum ophthalmic antibiotic solutions like physiognomic ointments or marbofloxacin or ciprofloxacin like antibiotics. And the treatment should be assessed frequently. And if there is non-healing ulcers, like in other animals, you can debride the ulcer and then continue the topical treatment. In this case also, it's best if you can take photographs and then you can assess the condition of the ulcer easily. And the diagnosis is same as diagnosis of ulcers in other pet animals, like you can use fluorescein dye. So pasteurellosis, I will talk about this because you see this condition in rabbits with otitis externa and otitis media, and then conjunctivitis and torticollis also can be seen other than genital infections and septicemia. So if you notice these conditions, you need to think about pasteurellosis. And then the treatment diagnosis is the most important thing. you can use procaine-penicillin, indofloxacin, or tamiflu to treat the condition. But when the rabbits come with torticollis, other than when you diagnose the condition, make sure you think of pasteurellosis as well, because rabbits are susceptible to Pasteurella infection. And coccidiosis is also a common condition in rabbits, especially the young rabbits after weaning. The mortality can be there if there's severe diarrhea due to dehydration and like hypoglycemia. So this condition is transmitted by fecal-oral route through ingestion of sporulated oocysts. You need to clean the environment daily, because when the infected rabbits, when they pass oocysts, they are not sporulated. So it takes about 3 days for the oocysts to sporulate and become infective stage. So if you clean the environment daily, you will not facilitate sporulation and transmission of this disease to other rabbits. So depending on the species of the coccidia, the lesions can be apparent in different places of the intestines. And look, most of the time, unless you diagnose, check the feces at early stage, you have to diagnose this during the necropsy. So identification is very easy. You can check the feces wet mount. In a wet mount, you can see the oocysts and sometimes microgonadia, and you can give treatments is trimethoprim sulfa or toltesuril. Where toltesuril, you can give it in drinking water when you want to treat the group of rabbits. So trimethoprim sulfa you can give us, which you can use pediatric syrups for young rabbits, but make sure as I told you earlier, like when you give rabbits oral antibiotics, especially even systemic antibiotics also can lead to gastric stasis. But when you give oral antibiotics, there is more chance of them to get into this due to changes in the microflora in the cecum. The gastric intestinal stasis can happen. So make sure that you advise the client to check for any bloatness in the stomach. And it's better if you can get the rabbit back daily or every other day to check for, to assess the condition. So that's all for the diseases. There are so many diseases in rabbits, but I thought I will touch on some of the common diseases. And then I have included some pictures how to syringe feed rabbits. So you can use about 50 ml syringes to feed syringe feed when they are not eating, because rabbit can't go on fasting because, as I told you, it will cause so many life-threatening problems in rabbits. So you can ask the client to grind or blend vegetables and leaves, and then syringe feed. But in some, like we don't have like high fiber rabbit pellets in Sri Lanka, which are very palatable, because some countries have like pellets like critical care diets. So you can, which is very high fiber and very palatable. You can use it when the rabbits are not eating. But here what we can use is, we can use baby food items which have fruits and vegetables, and then add some green leaves and grass, and then try to blend it and make a thick paste, and mix it with lactated ringer solution. So you can provide electrolytes as well, and then syringe feed the rabbits. And venipuncture, you can use, to collect blood samples, you can use central ear vein, or you can use cephalic vein, you can use lateral saphenous vein. You can even use jugular vein, but then jugular, if you are using jugular veins, you might have to heavily sedate or anesthetize the rabbit. So when you administer fluids, you can do subcut administration. Make sure the fluid is warm, and then you can also use lateral ear vein for giving IV fluids, or as I told you earlier, cephalic vein. So that's it for rabies diseases, common diseases. So if you have any questions, I will try to answer.
Yeah, thank you very much, Dr. Ganga, for a very informative presentation, very timely presentation. And the session is open for questions. Until people ask live questions, I can go through some of the chat option questions. There's one question from Dr. Nimal Jayavira. Are the ARV and the dose meant for dogs okay for rabbits?
Dose is okay. You have to give 1 ml. But there are some brands which are recommended by the manufacturer to be used in other species, not only dogs and cats. So I think it's better to use that type of a brand, but dose is the same.
Is it permissible, Dr. Ganga, to mention those brands in a public lecture like this? I don't know.
I would rather not, because you can see the manufacturers give
Manufacturers
recommendations.
recommendations, right.
It might not say rabbits specifically, but there are some brands in Sri Lanka which can be used that are recommended not only for cats and dogs.
Right.
I think that, I mean, I don't mind saying, mentioning brands since I'm not in that sector. But I think Rabicin is the one that's available here. We know for sure is okay with rabbits.
Right. And there's another question from Dr. Umesha Silva. What is the dosage and anesthesia of rabbit? I think Dr. Ganga has included a slide for that. So that's answered. And there's a question from Dr. Ruwan Sampath. It's a very broad question though. Why rabbits are sneezing and having wheezing sounds?
Sneezing, it could be due to an allergy, first thing. So there could be some allergic chemical or dust or pollen or something. Or it could be something like some infection, viral or bacterial infection could be there. So you need to examine, and then this you might have to take radiographs to check whether the lungs are affected. It's like any other animal. You diagnose respiratory condition in any other animal. You have to rule out, start with DD and then rule out the conditions.
And Dr. Ruwan, if you have any specific case, I think you can always reach Dr. Ganga in person.
Dr. Ganga, I have another question. Dr. Chandika.
Yes, Dr. Sugal.
Yeah. This is about trimming of our front teeth. Can we use bone cutter for that?
No. It might split the teeth. When you try to use a bone cutter, it can split the teeth and then damage the germinal tissue, and then the teeth will never grow in a proper way. So it might start growing in a different direction. So best thing is to use a burr.
And can we use bone cutting saw? It's like a saw.
I have never used it, but I have seen other people try to use it and causing splitting of teeth.
Okay, thank you.
But Chandika can add to that.
Yeah, and so actually,
Chandika, you all have done some work, no?
We have always used the electric burr. We don't have experience in using the manual instruments.
Okay.
Chandika,
I know you have a publication.
Yeah. Chandika, what about using of this nail trimmer, sharp, big ones, like, just to trim that?
What do you think, Dr. Ganga? I think it's also causing the same problem.
Yeah, it will also cause the same. It might work, but there is a possibility of splitting the teeth. So I think it's better not take the chance.
And there's another chat question from Dr. Tiruni. If the mother is not nourishing the infant rabbits, how can we feed them?
You can hand them using goat milk is a good supplement, unless you, or you can get a rabbit milk replacers. You can import, it's available.
All right, okay.
But when you first start it, so start very diluted milk and then gradually make into this proper concentrated milk. Because if you start with the proper dilution recommended by the manufacturer, sometimes it can cause problems. So start with diluted milk, with dilute it with lactated ringer solution.
And there's another question from Dr. Pavitra Sandamali. What about the oral ivermectin for skin conditions? Can it be used?
I have never used it, so I can't answer that question. But most of the oral medication can cause problems in normal gastric flora in rabbits, because they are cecal. They are, as I told you earlier, their fermentation occurs in the cecum. And then when the oral medications can cause imbalances in the flora in the stomach and the cecum.
So it's always better to give ivermectin as well.
Better to give it subcut.
Right.
Yes, Dr. Ganga, I have a question. Do you have any experience in sterilization of rabbit? I mean, castration now?
Yeah. Yes.
For birth control?
Sorry, yeah. That's normal practice. Sorry.
Castration. Do you have any castration or hysterectomy or hysterectomy?
Yes. What is the question? We have done castrations and hysterectomy of rabbits.
Yeah.
Because some clients request it. When they have a lot of rabbits and when they want to stop breeding, they come for the surgery.
Okay, thank you.
Do you have other clarification, doctor?
Okay, doctor. Samani, how can we it is performed as a normal cat or some? It's a way of surgery. I asked me.
Surgery technique, I think you'll have to.
It's surgical technique. It's difficult to explain, like without demonstrating. But I think you can get YouTube videos on sterilization of rabbits.
Okay, doctor. Right.
And there's another question, Dr. Ganga, from. Yeah, sorry, go ahead, Dr. Ganga.
So, like you have to maintain, careful about the anesthesia. Get the correct weight and then monitor the anesthesia properly, because surgery is not a complicated procedure.
Right. And there's another question from Dr. Sanuka. Interesting question. Can Flemish Giant and New Zealand White can make offspring?
They should be able to, but I don't have much experience in like breeding rabbits. But in farms they crossbreed and for improve production because they are same species. Theoretically they should be able to.
That's interesting.
Produce offspring without any issue.
And there's another question from Dr. Tiruni about how to wean a baby rabbit.
You don't need to if they are with the mother, their weaning will start within about. They will start gradually eating the mother's food, nibble on the grass and things when they're about 3 weeks or 4 weeks, and then gradually they will wean off. But if you are feeding, also if you're hand rearing the rabbits, then you have to follow the same procedure. You have to offer food, you have to let them nibble on grass. And the other thing is it's best to introduce them to adult rabbits, but very carefully, because sometimes rabbits can attack the young ones if they smell differently. So gradually introduce them to adult rabbits so they can the environmental microflora in the environment through cicatrophs. They can nibble on lick each other and get the normal flora into the gut. So the other thing is you can get cicatrose from a adult rabbit and gradually introduce it to a young rabbit. So the flora will be established in the GI tract.
And another question from Dr. Tiruni herself. What drugs can we use for diarrhea of the rabbits? I know it's a broad question. If you have any comment about that, Dr. Ganga?
You have to identify why the cause of diarrhea. If it is, first you do have to check fecal, you can check the fecal sample and see whether there are any protozoans, or coccidia, etc. Or otherwise, you need to do a culture anesthesia and find out the bacteria and the sensitive antibiotics and treat accordingly.
Right. And there's another question from Sri Lanka regarding nursing part. Doctor, tips to nurse rabbit kids if the mother is not around, how to feed and how many times, those kind of practical tips.
Yeah,
how to feed and how many times. You mentioned that we can use diluted goat milk, that's one thing, and how many times a day?
Well, rabbits normally the mothers feed them about once a day, few minutes. So you can give the feeding is make sure that you are not overfeeding the rabbit, that you have to start with small quantities and see how the rabbits do. And the other thing is keep them warm, like they are highly prone to hypothermia. So not only feeding, you have to keep them, make sure that they are warm enough. So otherwise they will die.
So even if we hand raise, doctor, like feeding once a day, would that be sufficient?
Yeah, once a day, because we are not giving the rabbit, it's not, unless you are using rabbit milk replacers, the nutritional values might differ. So you can try, like it's I have never hand-reared rabbits because normally rabbit females look after their young really well. Even in the zoo, we have never had any issues of hand-rearing rabbits, although we hand-reared so many other animals. Rabbits have been okay. So the problem is if the mother dies or something, then you might have to hand-rear. So you can try give like once a day feeding, but you and make sure that you have to measure the body weight daily, and then compare with the normal growing rabbit.
Do you have, Dr. Ganga, any idea about now any physiological specialty or something like that in rabbits for them to like feed only once a day? Because now for dogs and cats.
Now there are some animals that are like that. Some even feed like not even, they don't even feed the young ones once a day. Like small echidnas and all, they feed like once a week, as I remember.
Wow, that's interesting.
Yeah. So rabbits, it says in the wild that that's how they feed. So like because I have not hand-reared them, I'm sorry I can't answer the question, but I'll find out and I'll let you know, Tilanka. It's Tilanka, isn't it? Who answered that question?
Yes, doctor.
Yes, doctor. Thank you, doctor.
Okay, I will try to find it out and let you know, Tilanka.
And there's another question from Niranjala madam. Could antifungal shampoos be used on rabbits?
If they are recommended, yes. Because some are toxic to rabbits and their skin is very sensitive to chemicals. So normally the topical, the problem is not the active ingredient. The excipients in the shampoos might cause irritation of the skin.
Right.
Otherwise you can use mecanosol and all. The problem is the excipient.
Right. So even though the shampoo says just the ketoconazole or mecanosol shampoo, it's not a good idea to use it unless they have.
Okay. No, it might be okay. But like if you're using it, make sure that the clients are advised to look for any hypersensitivity.
Right. And there's another question from Dr. Ruan Sampath again. What are the causes for sudden death of bunnies having seizures?
Seizures can happen due to hypoglycemia. If it is sudden, like although the client say it's sudden, it might be not sudden because like rabbits, most of the conditions, like as I told you earlier, they are prey species. So they try to hide the issues and to pretend normally. So the clients might, the early clinical signs might go unnoticed by the client. So if it is sudden, it could be poisoning or toxemia. It's similar reasons for sudden deaths in other animals, or gastric stasis also can cause sudden death because of the heavy bloat. The respiration get affected and the rabbits might die. And hypoglycemia also can cause fits and death, and hypocalcemia also can cause it, but I haven't seen this hypocalcemia in rabbits much, but hypoglycemia is.
Right. There are lots of questions from you, Dr. Ganga, regarding rabbits. So before I go to the text questions, if anyone interested in asking live questions now.
Dr. Chandika, may I ask a question?
Yeah, sure, madam.
Yeah. Can fecal transplant be done for gut stasis in rabbits? Have you come across any literature?
Sorry, madam, fecal transplant.
Fecal transplant.
So you can feed them with secators of other rabbits.
Feed them.
Yeah, you can feed. You like if you gastrotomy, if you do, then you can introduce. But the easiest way is feeding them with soft feed, like secators of healthy rabbit.
Well, how about infusing it through the anus, rectum?
Will it reach the cecum? That's a problem. The best thing is to feeding. Best is feeding.
Okay, all right. Okay, thanks.
Dr. Chandika. Dr. Chandika?
Yes, Dr. Sagar.
Yeah. Dr. Ganga, I have one question. If rabbit come with a deep wound, can we give tetanus toxoid as we are giving to that one dog and cats?
Yeah, you need to.
Okay.
Yeah.
So they are also susceptible to tetanus.
Yeah. They are close to horses. Yeah, their digestion their digestion is similar to horses, and they are very pain sensitive. They can develop colic. They are not like horses, but like they can get the digestion and things are similar.
Right. And I will go into few questions of text questions from Dangola sir. Can dextrose be fed or glucose is preferred if needed? Can they be given per rectal?
Can, but not a lot, because soon after the surgery or something, if you feel that you need to provide energy fast, you can give a small amount, but best thing is to give it with IV infusion, because highly fermentable carbohydrates and things can cause gastric stasis in rabbits. So if you want to give dextrose or dextrose, the best thing is to give it with IV fluid.
Even small amounts, Dr. Ganga?
Small amounts are okay. Like soon after surgery, like if you haven't given IV dextrose, you can give a small amount just to like so that they will get enough energy. But not if you need to provide energy, the best thing is to give IV.
Right. And I think the next question is answered already. Which vein would you recommend for IV infusions? And from Dr. Nalanika, what is the best pain medication to give in GI disease like stasis?
Malocclusion. Malocclusion would be okay.
Malocclusion. And from Dr. Janit Gunasekara, if you can't keep rabbits, will the zoological gardens or wildlife take care of this?
Wildlife, I don't think, because the domestic rabbits are not wild animals, but wild hare, yes. Wild hare, if you find injured wild hare, because we have one wild species, Lagomorph in Sri Lanka. So those one, if you find injured or like orphan ones, you can hand it over to the wildlife department. But the rabbits, I'm not sure whether the zoo will take. You can inquire them. Early those days where they used to accept, but I'm not sure now. You need to check with the zoo.
Right. And from Dr. Wan, whether is it possible you to share your contact details, Dr. Ganga, so that they can reach you for any specific questions?
Yeah, SLVA can share it, isn't it? Or shall I tell my, what do you want me to do?
All right, yeah, we'll share it through the Secretary SLVA, Dr. Then.
Yeah, okay.
Right, and from Dr. Fernando, can we treat with antacids and anti-bloat agents for conditions like gas-filled stomach in rabbits?
Yes, I forgot to mention, like you can even give dry water, like to relieve gas, and you can give sucralfate, and you can give cimetidine, you can give ranitidine also.
And the same questions goes, what is the best analgesia that you have already mentioned, meloxicam? Can we use dexamethasone for GIT conditions?
GIT condition?
Yes.
I can't think of any justification.
Dr. Fernando, if you are still there, if you can get any clarification directly from Dr. Ganga? What type of instance you are referring to? If you can specifically say, then Dr. Ganga will be able to answer you more specifically. Or else once Secretary SLVA shares her contact details, you can like contact her directly. And there's another question from Dr. Gayan Indika. What are the birth control methods?
Surgery.
I think we have.
Yeah.
I think we have already mentioned about castration, surgical methods only. Dr. Ganga, do you use any other non-surgical methods?
No, I have not. I have not used.
So again, Dr. Ruan Sampath, can we feed them with bread and rice? Popular question.
No. No.
Right. Do you want to elaborate on that, Dr. Ganga?
No, because as I told you earlier, they need high fiber diet. So highly digestible carbohydrate shouldn't be given to them, which will definitely lead to gastric stasis. But there are some rabbits who are used to eating cakes and biscuits and bread and rice from small age. So they like for a while they manage without any problem, but their lifespan is short and they definitely get dental issues because they will not, when they get used to eating these highly palatable food items, it's almost impossible to get them eat this less palatable, high fiber grass and hay. So ultimately, they have to come to the teeth trimming and dental treatments very regularly to the clinics, and they don't live that long.
All right. And
can I jump in and ask some?
Yeah, sure.
Chandika, can I just to clarify on the meloxicam thing, they don't have any issues with gastric ulcers or renal problems when they are sick like that with GI disease and needing, they're okay? Meloxicam?
Yeah. No. You have to hydrate them. Like pain management plus, if they are dehydrated, definitely you need hydration. So they also have long-term use can cause problems. But with hydrated rabbits for about five days, I have never encountered any issues with meloxicam.
Okay, thanks.
And one other question from Dr. Niluka: what varieties of grass can be given? Is it kangkung? Is kangkung okay? Is the question.
Any variety, like if they have access to a grass patch, that's the best they can. They will eat grass and other weeds. But if you are providing them, kangkung is okay. But the only problem is kangkung has high content of water, so it fills up their stomach, but not much fiber is gained. But kangkung plus grass would be better rather than giving only kangkung. But anyway, the diet need to be like, you have to give a mix, like a variety of diet items in the diet, because otherwise it definitely will lead to some nutritional imbalances like vitamin and mineral deficiencies. So kangkung is okay, kangkung is fine, because most of the rabbits in Sri Lanka are reared on kangkung mainly. but it's better if you can provide like grasses and other leaves as well. But kangkung is much better than giving rice or biscuits or cakes or things. And the roots like carrots. Carrots are also sweet. So like when they get a lot of these sweet things, it's really difficult to get them to eat grass and other fiber diets. So
but even then you wouldn't recommend 100% kangkung. Is that so, Dr. Ganga?
No, but it doesn't cause like serious issues, but I would recommend to give grass plus kangkung. Grass, some kind of grass, like because kangkung has a lot of water.
Right. And a related question from Dr. Nalnika, can they eat types of leaves? Any suggestions? I think you have already answered that question.
They can eat a variety of leaves. Like carrot tops are good. All the carrots are not that only be given as treats. You can use carrot tops. And
no, she is specifically referring to other types of leaves, doctor.
Kangkung, mukunuenna, gotukola, those things you can give, but make sure that you wash them really well.
Even normal grass is okay.
The normal grass is the best actually.
And one final question again from Tilanka regarding the IV dilution of the dextrose. Is it 5% or 10%?
Yeah, same like for dogs and cats, but
right.
The dilution we use.
Right. So any other another question from Dr. Nimal Jaivira. It's a comment. Very informative presentation. Well done, Dr. Ganga, and thank you. So any other questions that you can ask the audience to get maximum use of Dr. Ganga?
You can always contact me if you have a problem. Once my contact details are distributed.
Actually, it's really difficult to contact her, guys.
And there's one more question. Why mother rabbit eat its own offspring at the delivery from Dr. Wan?
Sometimes it can happen like in other animals because some mothers kill young ones. Even it's common in a lot of species. But most of the time what happens is they eat them after the death of rabbits due to some young ones due to some reason. As I told you in my presentation, it's like a nest cleaning instinct. So if the young ones are dead, they will be eaten by the mother. But in some animals, like some animals will kill and eat. Yeah, that's also common. So what you can do is to not to breed the female and get her spayed if that happens.
And there are comments from all the other doctors thanking Dr. Ganga and the SLVA committee. And if you don't have any other questions, I would now invite Dr.
Chandra. Wait a minute, Chandika. Thank you very much, Dr. Ganga. It's highly exciting, webinar today you conducted, because we see a lot of questions coming from our senior veterinarians, our teachers. That shows how interested this subject is. Actually, the very timely one. Thank you very much, Dr. Ganga. I have one only question: whether can we use fipronil on rabbits? This frontline like?
No.
You have any experience?
No. You can't.
It's not at. Okay.
I have a very bad experience. Without knowing, I used frontline and the rabbit died.
Okay. Yeah. I have never used, but I wanted to ask the question. Yeah. Thank you very much, Dr. Ganga.
Ivermectin and selamectin can be used for external parasites if you want to. Selamectin also can be used.
Okay.
All right. So now I would invite Dr. Sugat Pemachandra, Secretary of Sri Lanka Veterinary Association, to deliver the vote of thanks.
Thank you very much, Dr. Chandika. Good afternoon to everyone. Dr. Rantika Gunawardena, the President of Sri Lanka Veterinary Association. Dr. Ganga Wijesinghe, our resource person today. Dear doctors, ladies and gentlemen, on behalf of Sri Lanka Veterinary Association, I take this opportunity to extend our most sincere gratitude to Dr. Ganga Wijesinghe, who accepted our invitation as resource person despite her busy schedule today. It's a really informative, creative, useful presentation. Thank you very much, Dr. Ganga, for your great support. We believe the knowledge you have shared with us will improve our knowledge and the skills for rabbit medicine. And also I would like to thank Dr. Chandika Wijesinghe, our moderator today. And I would like to thank participants, especially different part of the world, India, Malaysia, Singapore, EUA countries, and Bangladesh. And also I would like to thank doctors and the student from Sri Lankan community who participated today to make this workshop a success. Thank you.
Thank you very much. See you at another SLVA seminar.